Hello, hello, everybody. Welcome to the IOCDF Research Roundtable, the live stream where we pick a topic in the OCD literature and discuss it. Before I say anything, I gotta say there's a new graphic. John, I don't know if you noticed that on
I love, it is a new graphic. I like it a lot. I wonder if that's Amanda's doing.
It's either Amanda or Fran, but in any case, it's looking snazzy.
Yeah.
So we have to uphold the snazziness throughout the entire live stream.
We'll do our best.
Yeah, I have to pick up my etiquette. But anyway, as always, my name is Kyle King. I am a senior now, which is really scary, at Yale University, studying neuroscience with a focus on OCD. And that's not only because I think it's a really fascinating disorder, but also because I have it. And I'm joined by my co-host, Jon Abramowitz, which is over here now.
Hello. I'm a little more senior because I just had a birthday last week. But I'm not a senior in college. I've been there and done that, but congratulations. And I am Jon Abramowitz, though, and I am a professor at the University of North Carolina at Chapel Hill, and I'm a clinical psychologist, and I do lots of research and clinical work to study and help folks with OCD, which is really my life's work and something that I love doing very much. And I am pleased to be here with you, Kyle, and with Mike, who is one of my very first graduate student from back in the day. What a pleasure to have you with us.
Yeah, hi. Thanks for having me, Kyle and John. Nice to be back with you.
I taught you everything you know, didn't I?
That's probably true. Yeah, I haven't learned a single new thing since I graduated.
Definitely not true.
Just been coasting on the knowledge that John gave you.
Sort of. Riding John's coattails has gotten me pretty far.
Well, you do make me look good by all the awesome stuff that you've done since leaving UNC.
Well, it was all what we learned there. It was a great program.
I have quite a long and impressive biography of Michael to read, but before I read that, first, happy birthday, John. I don't know how old you turned, but happy birthday.
I'm 54 for the record.
Okay, you're still younger than my dad, so you're fine.
Okay. And you know what? I always will be younger than your dad.
That's true. And I do have some announcements that I need to say first. So before we get started, this live stream is educational and is not intended to replace therapy. For treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDF's online resource directory at iocdf.org/find help to locate a trained clinician near you. The International OCD Foundation is not a crisis hotline. If you're in a crisis or if you're ever feeling suicidal or unsafe, please go to your local emergency room or call 911 or the 988 Suicide and Crisis Lifeline by dialing 988. We want to create a safe space throughout this program. There is a live chat feature. We love it when you say comments or ask us questions while we're talking in the chat, and I'll try to get to any questions that you may put in the public comment section. Just know that this is live, and whatever you put out on the internet will live there forever. So please be respectful and don't say anything too rude. You can insult my hair if you want, but that's where we're going to let the insults die. Okay, so we normally have two guests on the show. Hopefully our second guest will be able to join, but if not, Mike's going to carry the conversation. So our lovely guest is Michael Wheaton, who's already been somewhat introduced, but I'll read his official biography. Michael G. Wheaton is assistant professor of psychology at Barnard in New York, and he joined the faculty in 2017. Prior to coming to Barnard, Dr. Wheaton was a postdoctoral clinical researcher in the anxiety disorders clinic at the New York State Psychiatric Institute and previously taught at Yeshiva University. His research interests focus on psychopathology and treatment of OCD and OCD-related disorders, with a particular emphasis on behavioral therapy. He's a licensed psychologist in New York State and teaches classes in normal psychology and clinical psychology at Barnard. Mike, let's see, what's a good intro question? We're going to be talking about perfectionism today. So what's a movie that you think is nearly perfect, but not quite perfect?
Oh, that's a great question. Well, I didn't prepare anything in advance, but I've heard that the movie Back to the Future has a perfect script because the way that it fits together, they had to do a good job, all the elements of how's it going to fit together. So I think Back to the Future is a perfect film.
Okay.
There's Anthony.
Oh, Anthony,
Hey.
how's it going?
I'm so sorry for all the tech difficulties, but it was the browser I was using.
No worries. We're using Safari.
Yeah, it was. I think I was using Internet Explorer, and then I had to switch over to Chrome. But that was the answer.
My parents still use an AOL email, so
I know. I think I'm tech savvy, but I guess
actually.
not.
So this is our second guest, Dr. Anthony Pinto. Do you mind if I introduce you?
Yeah, please. Thank you.
Anthony Pinto is the director of the Northwell Health OCD Center at Zucker Hillside Hospital on Long Island in New York, and associate professor of psychiatry at the Donald and Barbara Zucker School of Medicine at Hofstra/Northwell. Dr. Pinto has an extensive publication record with over 100 manuscripts, chapters on OCD, on obsessive compulsive disorder and related conditions, particularly OCPD. He's a leading author on OCPD and co-edited a comprehensive book on the subject, OCPD, Obsessive Compulsive Disorder, American Psychiatric Association publishing. And he's the lead author of the self-rated Family Accommodation Scale for OCD, which is being used worldwide. He also serves on the IOCDF Scientific and Clinical Advisory Board. Anthony, I'm going to ask you the same question. What's a nearly perfect movie, in your opinion?
A nearly perfect movie?
Yeah.
I was just listening to this podcast about Back to the Future, and it has all of those elements. Oh, did you say that?
I said Back to the Future.
That's what Michael said.
And we even coordinated our shirts and we coordinated our answers.
Yeah.
Okay, so everyone needs to go out and watch Back to the Future. I've never seen it, so I don't know. I can't attest
my
to
goodness.
It is one of the best of all time.
Yeah.
That's nearly perfect.
And then the second one was pretty good, but the third one was not so great.
Yeah.
So today, as I kind of gave away, we're going to be talking about perfectionism.
Mm-hmm.
It's something that is near and dear to my heart, just like OCD, because I struggled a lot with compulsions of like trying to get my homework perfect, trying to get perfect grades all throughout high school. So I'm really excited to learn about it, but I want to start from the very basics, which Michael and Anthony, what is perfectionism? Like, is it a personality trait? Is it a diagnosis? What is it?
Do you want to start, Mike? Or?
That's a great question. I think we should say it's not necessarily one thing. It's like a multifaceted entity. There may be different elements or dimensions of perfectionism, but I think probably we're thinking of it in terms of a trait. There's not a diagnosis for perfectionism, and it's probably along a continuum of some people more so, some people less so, rather than like a binary of you have it or you don't have it. And then there could be, the different elements would be the tendency to have high standards and striving for achievement. And then maybe the maladaptive would be where it focuses on the discrepancy between when you have high standards and then real world outcomes are not at the level of standards, having a hard time reconciling those. And so I guess we could differentiate between adaptive perfectionism and maladaptive perfectionism. But Anthony, do you want to say more?
Add a couple of things. So, what Mike and I do in our clinical work as well as in our research is focused on that maladaptive form that Mike referred to, and that includes extremely high standards and this unrelenting pursuit for these high standards, which the individual feels like they very rarely, if ever, achieve. And there's a fear of failure, attempts to avoid failure. But the other piece is overly critical self-evaluation. So there's like an intense criticism of the self that then can affect mood and overall functioning. So those are the maladaptive features that we focus in on. But as Mike said, striving for high achievement, those can be adaptive qualities and typically associated with conscientiousness. But the maladaptive form is correlated with neuroticism and other aspects of psychopathology.
And does it tend to come up in like the same situations, or is it really varied in where you see perfectionism manifest?
Yeah, I think it's a great question, because like one of the things that we'll do when we first meet with somebody who's coming in for perfectionism is take a look at where is it showing up in your life and what life domains, because it often shows up in work and school pursuits, but it can be in terms of how you maintain your home. It could be in terms of your own appearance. We know there's a strong role of perfectionism in eating disorders and as well as body dysmorphic disorder. So it can show up in your social pursuits, your leisure. I often see patients who have difficulty making time for leisure because it becomes work-like for them. So it can affect work-life balance. So it can show up across life domains. relationships, for example,
Mhm.
just to name a few.
So if I understand it correctly, like it's a trait, like, I don't know, being funny or something. And then there's a spectrum that kind of we all land somewhere on. And if you're way off to the right, let's say, then it becomes maladaptive, and that can be in any single life domain.
That's correct. Yeah. Yeah, we really emphasize studying personality traits on a continuum, just like you described, Kyle. And, rather than just focusing on personality disorder categories. So looking at these personality traits that way, having high levels of this particular trait can affect your functioning, but can also affect how you respond to treatments for other conditions. Having high or maladaptive forms of perfectionism can affect how you respond to treatment for OCD, for other anxiety disorders, GAD. So it's an important trait that we want clinicians to be aware of and be on the lookout for.
And I think I would just say, like, in addition, the idea that can be kind of domain specific or more pervasive. And when we're talking about more a personality disorder, it's where it's more expressed sort of pervasively and rigidly, whereas people who maybe dialed back on the perfectionism traits might have things that they're very particular about that are more like quirks. Like for me, like I like the dishwasher to be loaded a certain way because like that's the way that I want the dishes to be arranged. And I probably am like maladaptive about the dishwasher, but that doesn't like carry over to other elements of my life. Whereas if it was really like everything is like that, and I get perfectionistic about everything, then it would become probably more maladaptive.
Right. Mm-hmm. Yeah. The other aspect of perfectionism, just in terms of like how we break it up into different dimensions, and this is something we could talk more about, like how do you actually measure this? But while we often focus on self-directed perfectionism and like high standards that I have for my work and my achievement, or even how I load the dishes, like in the dishwasher, there can also be perfectionism that is influenced by how you think, other people might be judging you, or standards that you might hold other people to. So it can also lead people to be more other oriented in their perfectionism in terms of like having high judgments and criticism of other people.
Mm-hmm. So I have so many questions. I don't know where to start. I think the first thing I want to ask is like, so if I, let's say, I'm to one side of the continuum and I want, let's say, my dishwasher to be perfect. Does someone who's kind of experiencing these perfectionistic tendencies tend to believe that like what they're doing is right? Like they should be holding these beliefs and these standards?
Yeah, often that's like going along with the personality features is a level of ego-syntonic nature of it, that it feels correct. And as opposed to certain OCD symptoms, they're ego-dystonic in that the person feels like, oh, I wish I didn't have to do this, but I feel compelled to do it. Here, it can be the case that the person is saying like, yeah, I want it to be this way, or agreeing with the standard.
Mm-hmm. Yeah. Is it always the case? Because like I can remember doing my homework for hours and like not really loving the fact that I was doing that and not hanging out with my friends, but.
Yeah, so this might be something that we would try to address in treatment, is trying to raise awareness of there's the standard coming out and looking for sort of the pros and cons of maintaining it. Like, so yeah, that's a great example of like, if you listen to the rule, you'll follow the rule, you'll honor the rule, but you're not honoring your friendships because you're not able to. So within, that's something that we work on in therapy, is sort of like choosing what to prioritize. Is it really best to prioritize the standards, or like, do you have values that are being neglected if you're focusing on the rules?
Yeah, and I think one of the things that we look at is like the role of certain cognitions, like black and white thinking. And so somebody who has this maladaptive form of perfectionism may feel like, I can't socialize at all. I need to spend all my time on these kinds of productive or achievement related pursuits. And over time, what we see is those individuals, their self-worth or how they identify themselves is very much like overly linked to achievement. And so if things aren't going well in work or school, then your self-worth takes a major hit. And that's where you can see like drops in mood or like other forms of anxiety.
That's kind of how, when I was in graduate school and kind of learning about this and training in CBT, the idea was that like the cognitive distortion, kind of, Anthony, as you mentioned, like this black and white kind of all or nothing kind of thinking, and that folks who have a lot of this, like they've got these rigid rules for how things must and should be, and they just kind of set themselves up for disappointment because their expectations for themselves or sometimes for others are so high that it's impossible to reach those, and then they're beating themselves up for not reaching them, like you're saying, and kind of making themselves miserable.
Yeah, I think one of the experiences that our patients often talk about is like chronic frustration, like feeling that they are letting themselves down, feeling they're letting other people down. Maybe if they are more this other oriented type, that feeling like other people are not doing things that they should be doing. So there's this feel of like, being, things are not right. Things are not, the world is not the way it should be. And so that is a very heavy, taxing experience for them.
So like, you're kind of talking about perfectionism. At least it seems like to me, like it's I know it's not a disorder in and of itself, but like we're talking about people who are just kind of seeing things and wanting things to be what they deem to be socially valuable, I guess, or like what they deem is correct. And I'm thinking about OCD, and like what I strived for when I was really sick was like washing my hands and like being as clean as possible, which I don't know if that aligns super well with like what is a socially super valuable goal. So I guess like does the values that someone who's experiencing perfectionism might hold, does it always map on to like what's socially valuable? Like how do perfectionists tend to get what they're being perfect about? That was a really long-winded way to ask that question.
Yeah,
I think you're raising.
Go ahead.
Yeah, go ahead, Mike.
I was just going to say, a lot of times it's about like achievement-oriented perfectionism that can be both social, of like wanting people to think of you in a certain way, wanting to accomplish impressive things, but also maybe the self-evaluation of like wanting those for internal motivation reasons. But whether it's, career achievement, academic achievement, a lot of times it is achievement-oriented perfectionism.
Yeah, I mean, I think you're bringing up like a sort of important distinction here between like how does perfectionism or potentially OCPD, which is like where perfectionism lives within the DSM, how does that impact other conditions like OCD, and I think that like Mike was saying, I think there is in adherence to rules and a worldview that things need to be a certain way in order for me to be, if you have OCD, to feel safe, to feel certain. And so, in your case, if it had to do with hand washing at that time, that was a link, that you over-identified with as a way to feel okay. And so that, that tendency to depend on rules, I think is a key aspect here in terms of what Mike was describing earlier, in terms of like a rigid, worldview, and like wanting those, to follow those rules in order to what you think is going to be helpful, but ultimately leads to, disorder.
So just because you brought it up, I want to jump into the DSM. You said perfectionism lives in kind of the OCPD diagnosis.
Yeah.
What is OCPD? Kind of what are the characteristics of that?
Yeah. So OCPD is one of the most common of the personality disorder categories, and it exists in studies range anywhere from like 3 to 8% of the population, but it is a fixation on rules, order, perfectionism, rigidity. Like those are core features of the disorder, but leads to functional impairment in terms of relationships, in terms of school work pursuits, and there's like a sense of distress that these individuals report. These are usually long-standing, so I mean that's OCPD as a category. But as I said, we also want to like pay attention to see if perfectionism exists on its own, because it's possible somebody could have some of these negative effects of perfectionism without having the full categorical definition of OCPD.
Mm-hmm.
Mike, you want to answer that?
Yeah, no, I think exactly. Like OCPD is a little bit broader than solely perfectionism. Like you can't be diagnosed with OCPD if you only experience perfectionism. You would also have to have, I think, at least 3 other of the traits that go along with OCPD. And the idea that perfectionism itself could be transdiagnostic, so people could be experiencing perfectionism without the full suite of OCPD traits, with including like perfectionism related to other conditions like an eating disorder, OCD, depression, a lot of the time.
Yeah. Mm-hmm. Yeah, because I'm thinking about like if perfectionism is kind of setting these standards and then trying to attain them and getting frustrated when you aren't able to, like that sounds like something, if you have an eating disorder, like you want to not eat a certain amount of calories a day, and that's a standard you set, and you'll get frustrated if you don't attain it. So it sounds like perfectionism could live like anywhere in the DSM, really.
Yeah, potentially. Yeah, transdiagnostic perfectionism has been linked to like a whole array of conditions.
Yeah, I mean, we will see perfectionism across anxiety disorders, eating disorders, depression, OCD. So yeah, it's something that we want to like be aware of, because it can impact treatment outcome. And in some cases, you may need to focus in on the perfectionism before you can get to more disorder-specific interventions. So in other words, building, like bolstering flexibility, because what's going to happen if you don't do that is that those individuals will then use that perfectionism and apply it to the treatment. So then they'll feel like, I'm not doing my exposures perfectly, so why bother? And perhaps they are going to be less likely to generalize like what you work on in your treatment to other areas of their life. Or in the worst cases, maybe they'll drop out of treatment because they're feeling like, I'm not making improvements the way I thought I would. Another way it could interfere is it could affect the relationship with the provider. So, and we know that's true across disorders as well, that we've seen that in depression as well as in eating disorders and OCD. So it's an important thing to be aware of, because it can actually affect the process of treatment. If somebody has adaptive perfectionism, though, that might actually help them in the treatment, because maybe they're going to be more adherent to doing their homework and more, and more likely to respond. So I think it really depends on what form perfectionism is playing for that particular person in terms of how it's going to affect the treatment.
John, do you have? I have a couple of questions, but I want to give John a chance.
No, go ahead. I'm taking it in, and I'm happy to contribute as needed. But no, fire away.
Thank you. So you said like if someone has these perfectionistic tendencies, you might want to address that first before going for the core symptoms. My core symptom was like I was hand washing a lot, and well, no, let me back up. How would you know, like, oh, this person has perfectionism that we ought to tackle first?
Right. Yeah. No, that's great, and that's a lot of what like Mike and I are thinking about, and we just submitted something to talk about this very topic for the IOCDF online conference this fall. So I think going back to like the setting up the treatment, you want to assess like what, how big of a factor is perfectionism for this person? How much is perfectionism like intertwined in the OCD itself? To what degree is that person's self-worth, really wrapped up in, their, achievement, for example, and as well as just overall readiness. Like if somebody is a maladaptive perfectionist, they're probably going to not be, well balanced in terms of sleep and eating and, physical activity and leisure. All of those things are vulnerability factors that make you much more likely to have like depressed mood or high anxiety. So if somebody comes into treatment already, low on those factors, their tank for making behavior change and treatment is going to be very low. So we want to address those factors, build them up in terms of their readiness for making change, but also assess like the perfectionism itself, and in terms of like, how is this person going to be receiving ERP? Are they going to be able to integrate it, or is there going to be this like difficulty in terms of judging themselves, being hypercritical? So those are some things you want to be on the lookout for in terms of determining whether you should, as a therapist, approach the perfectionism first.
How do you kind of separate out though, like where's the perfectionism, where's the OCD? Like they seem to be really commingled. It seems to me like the perfectionistic tendencies would be maintaining the OCD.
Yeah, so I'm glad you asked that, because
there's a question in the chat that is right along those lines, Kyle, that maybe we can put up from Tom W from 1228. Where's the line between OCD and OCPD? Right. And
okay.
I think that's right. Is that what you're getting at?
Yeah, but before we address Tom's question, maybe just getting back to you, Kyle, if you are, as a therapist, going to approach perfectionism in this individual before you get to ERP for their OCD symptoms, I would suggest working on perfectionism in non-OCD areas. So, for example, like, encouraging that person to like take some chances or to change up their routine, so that you can help them engage in that this ACT concept of willingness, like making a choice that I'm going to try something new or move towards something that I care about, despite the fact that I'm going to feel uncomfortable or judge myself. So you're going to want to like work on some of the non-OCD perfectionism before you then make that shift. So maybe did you want to comment on that, Mike, and then we'll talk about Tom's question?
Yeah, well, I think I would just say, so this is like illustrating this phenomenon we have as clinical psychologists. Sometimes you ask us a question and the answer is always like, it depends.
Yeah.
And like,
I've learned that the hard way.
Right? Like we can't give you a straight answer because it's complicated. It depends. So is perfectionism going to interfere with your OCD treatment? Well, it depends. Like it could be maladaptive if it interferes in your ability to participate in the treatment. Or actually, like the research data is sort of unclear. Like Anthony has great research showing more perfectionistic traits, what wasn't as good an OCD treatment response, but that's not always the case. Like we had other research we've done together where perfectionism was not linked to treatment outcomes. So, and then the UK group, Salkovskis, they have research showing that more perfectionistic patients did better. So it's a little bit of a mixed bag that we're interpreting as it depends. Is the perfectionism, the high standards part, going to motivate you to want to participate in the treatment well? Or is it going to be maladaptive perfectionism that, like Anthony was saying, maybe you won't try with your exposure homework if you think like, I was supposed to do 90 minutes of exposure. I only have a half an hour in between like the things I have to do. It's not going to be worth it. It's not going to be enough. It's not a perfect exposure, so I'm not going to do it. Then like the interference would be that you're not participating. So I think how I have thought about it, connecting it back to other research we've done on OCD treatment outcomes, is kind of using adherence to treatment instructions as a barometer to like monitor how the treatment is going. So you could sort of tell, like, is this perfectionism going to interfere? Well, we have to sort of like try the treatment and then look out, be aware, like perk our ears up to hear, are you having a problem with the homework adherence? Like, and why? Was it perfectionism? Because then maybe we do need to address perfectionism so that is not going to interfere with your OCD treatment. So that, and then maybe like Anthony's saying, we'll do perfectionism exercises to try to practice flexibility outside of OCD first to see that it's possible, and then we'll bring it into your exposure practices.
Yeah. And we could talk more about like how to do that, but like
there's so many questions, but there's a question up on the screen.
Yeah. So
sorry. Yeah.
Let's talk to refer to Tom's question here. So, in terms of like how you differentially diagnose OCD versus OCPD, one of the distinguishing factors, although we know there's an overlap between these two. A distinguishing factor would be in OCD, you have the presence of obsessions, intrusive, unwanted thoughts that tend to have this irrational content, versus OCPD, which we see as egocentric and like as part of like your worldview, how you think things should be. What we do know though is that according to like the meta-analyses, like these large like studies that have combined many studies, is that 25% of people with OCD also meet criteria for OCPD. So, to Tom's question, it may not be in your situation that there's a necessarily distinction. These disorders often co-occur. So that's the situation that we're referring to here, where the clinician and patient have to work collaboratively to figure out, which one to focus in on first and how to sequence the treatments. So just going back to what we were saying earlier, though, is that, when in terms of like how you target perfectionism, you do want to have a good sense of like what are all the different rules that the person has, and then can you create some behavioral experiments to test out, what would happen if you were to break this rule, and so they can then have like a experiential learning experience to see what happens if I don't load the dishwasher that way, or if I don't iron my shirts before going to work, or if I were to go on a trip without my packing list, so whatever their particular rules are.
Mm-hmm.
And what are some of the things that they would be afraid of happening if it's OCPD? What are some of the things that they would predict would happen that the exposure shows them wouldn't happen?
Yeah, I mean, I think like in those, so if it's OCPD, the rules just become like something that they feel like is necessary for good outcomes. And so it's not, you're not going to have that sort of irrational feared consequence that you see in OCD. It's going to be more like, this is the way I've always done it, this is the way it should be, I'll feel uncomfortable. And so there's that experiential avoidance piece of like, I'm just going to like continue doing it this way, even though I know it takes me longer, so maybe it's not as efficient, but this is, so there's like a dependence on this way of doing things because it's what's familiar and what makes me feel okay.
So in OCD,
as opposed to OCD, where they're predicting some catastrophic outcome.
Yeah, a catastrophic outcome, or this idea of like, I won't be able to cope. Like if you have somebody with like a not just right experience, like it would be intolerable anxiety.
So do you see the not?
You go, John.
Sorry, Kyle.
No,
do you see the not just right experiences in OCPD also? Because that's, I know, like clinically for myself, that's where, not that I worry too much about diagnosis, because I'm more like what you were saying. I'm more about like the function, the cognitive basis. But that not just right experience, seems like that's like the bridge. Like that's where you see that in folks that you would clearly say this person has OCD. And then also clearly, folks that you would say clearly this person has OCPD.
Right. Yeah. Do you want to address that, Mike?
Yeah, I think, it could be where the overlap is, and like those studies Anthony was mentioning, where like they look at a population who experience OCD and find that 25% have OCPD as well. It's more common to have among that group with the combined presentation those symptoms of like incompleteness or not quite right, or so that may be driving some of the association. Also, though, I would just say, like, sometimes with perfectionism and OCPD, it can be much more like across all domains, whereas the not right feeling can almost be more like a sensory phenomenon of like it just doesn't feel right, like at a visceral level. But I think there definitely could be overlap.
Yeah, and the people who have the incompleteness or not just right type of OCD, they tend, according to the studies, have like higher rates of perfectionism. So, I think the not just right experiences, you're going to tend to see more symmetry, ordering, repetitive type behaviors. A bit different than in OCPD, where it's purposeful, may take them longer. They're still methodical, but yeah, I agree with you, John. I mean, that's the area that's very sticky in terms of like, how do you parse these things out?
And if I understand it correctly, OCPD, like, is someone with OCPD, do they actively like want to change? As like someone with OCD, maybe like it's ego dystonic. I don't want these things.
Yeah, that's a great question, Kyle. Because one of the, I think, misconceptions about OCPD is that these people don't come into treatment because they feel like I'm right, everyone else is wrong, and this is the way it should be. I think with more availability of information through the intranet, I think these individuals who tend to be to their detriment hyper researchers, so they find this information and they are seeking out treatment because of the frustration I was talking about before, but feeling like so taxed by the rules and the burden of having to live a certain rigid lifestyle that they're realizing it's affecting their relationships and their ability to like move forward in their lives, towards their values. So they are seeking treatment. I would say that the ones that seek treatment tend to be more of the anxious component of OCPD, as opposed to like the type of OCPD that's more outwardly hostile, hypercritical, that more hostile dominant type. So those people, at least in my setting here where we treat OCD and OCPD, we tend to see more of the anxious ones as opposed to those that are, more aggressive and outwardly critical.
Mm-hmm. So, I don't know, Michael, you want to add something?
No, I think that's right. I mean, people are experiencing impairment and may want to come for treatment. What they might not be at first insightful or committed to is the idea of changing the standard. It might be more like, I'm having disagreements with other people at work, or I feel so exhausted and burnt out from having to try to maintain this level of performance that they're sort of like burning the candle at both ends and just like, but they're experiencing distress and coming for treatment. And that's often the first place is like consideration of these standards rather than commitment to wanting to change the standards.
So I want to kind of get back to like OCD specifically. So just kind of a more basic research question is, well, actually, let me start with perfectionism. More basic research question. How do we measure perfectionism? Is there like a scale that you just kind of like tick boxes on?
Yeah, there are actually like a bunch of scales for perfectionism. And so some of the more common or popular ones are, there's one by Randy Frost. It's a multi-dimensional perfectionism scale, which has 6 different subscales that make it up. There's a Hewitt multi-dimensional scale, which gets into that aspect of self-oriented versus other-oriented versus socially prescribed perfectionism. There's a scale that Mike and I used in one of our treatment outcome studies. It's called the Almost Perfect Scale, and that one gets at the difference between high standards versus this discrepancy, which is like this maladaptive form of perfectionism where you feel discrepancy between your personal standards and your actual performance. There's a perfectionism questionnaire that looks at healthy versus dysfunctional perfectionism. So those are some of the perfectionism scales. My colleagues and I also developed a scale that is a self-report measure of OCPD. It's called the POPS, the Pathological Obsessive Compulsive Personality Scale. And that has 5 factors, including a total score that gives us a severity measure of OCPD. One of those subscales is maladaptive perfectionism. So that's another way to measure it.
And when are these measures, do they tend to be correlated with OCD severity? Are they higher in people with OCD versus people without OCD?
Yeah, in general, yes.
Mm-hmm.
But there's variability within groups. But yeah, on average, people like an OCD, a sample of people with OCD tend to score higher on perfectionism measures. Yeah. And it's even included in the obsessive beliefs questionnaire. There's a subscale related to perfectionism, but then it kind of mixes with tolerating certainty.
Yeah. So like in the theoretical conception of OCD, does perfectionism play a big role in kind of like the maintenance of the disorder?
So in terms of like the obsessive beliefs questionnaire, which was developed to try to, and Jon was one of the ones who developed that questionnaire, right? So maybe you want to say like what
Jon
was to include.
Got to take over.
Yeah.
Now is my chance to shine.
Yeah.
You know, I was part of that group, but I actually came along after they had developed the scale, and I was going to ask you guys, the overlap, right? Because originally they found these 6 domains of obsessive compulsive cognition. So it was overestimates of threat, overestimates of responsibility, importance of thoughts, the need to control thoughts, and then there was perfectionism and the need for certainty. And in some of the later analyses, perfectionism and the need for certainty were kind of grouped together. And I never completely understood why those two things go together. I don't know if you guys have any thoughts about that.
Yeah, it's a great question. I think maybe it has to do with like the wording of those particular items and the way they did the factor analysis to try to reduce the scale, because I think people usually think of those as related but separate constructs. And there's the intolerance of uncertainty scale, and there's perfectionism scales, and those have a moderate correlation. But to merge them together, you probably want like a much higher correlation.
When we've looked at it, Mike, in our work, like data collected here at Northwell, the intolerance of uncertainty and maladaptive perfectionism were highly correlated, but they're not the same. I mean, I think that we found correlation high for psychological variables, but like distinguishable still. So I think those are things that we think equally will affect OCD expression and severity, perhaps outcome, but yeah, I mean, I think like we're getting at, there's so many ways to measure this, and so definitions and being able to be clear about what you're actually including in these studies is so crucial, because these are overlapping variables.
Yeah.
And just to mention it, that this idea of the obsessive beliefs questionnaire was to try to like isolate beliefs related to OCD, but with that particular subscale, like I think it's Dave Tolan's work that shows that those forms of obsessive beliefs are not specific to OCD. Like those are elevated in other anxiety conditions. So perfectionism may be related to OCD, but not necessarily in a specific way beyond other anxiety conditions.
Yeah, and so you were saying, Kyle, like, is perfectionism like something that predisposes somebody to OCD? And we've done some work looking retrospectively at what some of these personality traits that people with OCD report having as children, and perfectionism certainly comes up. So it can potentially predispose. You'd really need to look at longitudinal studies to get a better sense of that. But we also know that's true for other things, like perfectionism is considered to be a risk factor for certain eating disorders, particularly anorexia nervosa. So it's something that that could be a vulnerability, a personality vulnerability for some of these later onsets.
Theoretically, is it considered a crucial component of like maintaining OCD? I read some literature stuff, and the question was like, is it a maintaining factor for OCD anorexia? And I don't really know what maintaining factor really means that well, but what is a maintaining factor, and is perfectionism one of those for a bunch of disorders?
You want to go, Mike?
Sure. So I guess by maintaining factor, like the idea would be that maybe I think in particular with OCD, if you're thinking about ego dystonic obsessions that come into your mind that we're trying to, in behavioral therapy, normalize and have the person, recognize as being products of your mind that you don't have to listen to or follow the rules by, maybe perfectionism could be a maintaining factor in that the person is not able to break that association with like having the thought and engaging in compulsions or, and I think it potentially could be like if you're following high standards for not wanting to take any chances or rules for your own conduct or for others' conduct, that sort of trait could be something that you don't get to break the spell of an obsession. Maybe it's a maintaining factor in that way.
Yeah, I mean, it could also, and it could be a maintaining factor in terms of your openness to being uncomfortable. So experiential avoidance, like I was mentioning earlier, if you take active efforts to get rid of or avoid uncomfortable thoughts or unwanted inner experiences, thoughts, feelings, that could also maintain these conditions, because as we know, for ERP to be successful, the person has to be open and willing to be uncomfortable so that they can achieve safety learning or learn to tolerate these uncomfortable experiences. So that's another way that perfectionism may be a maintaining factor. Could also be maintaining in terms of your perfectionists sometimes have a sense of I have to have orderly thoughts. I can't have thoughts that don't make sense to me. And so if they come up, I need to do something to get rid of them. And so as we know, that would also maintain OCD. So how it actually maintains is, we can speculate. I mean, it's hard to actually tease that out in research.
And Kyle, just to your question about, what's a maintaining factor, and other people might be interested in that too. We in clinical psych and cognitive behavioral terms, we differentiate between the factors that we think might contribute to the cause of a problem, like OCD or perfectionism or anything, and then the factors that keep it going, right? So, someone might, let's just take a phobia, someone who has a fear of dogs, right? That fear might be learned somehow. The person might be bit by a dog. The person might have been chased by a dog or something like that. And that might have led initially to the cause of it. But then for most people that experience a dog bite, their fear goes away normally. So there's other factors that kind of take over and maintain the problem. So if I never go outside, if I never am around dogs, or if I only pay attention to information talking about how dogs are threatening, that keeps my fear alive, right? And those are two, there can be overlapping factors, but those are two different types of factors. Treatment from a cognitive behavioral perspective tends to focus more on the maintenance factors. We want to reverse those maintaining factors because the cause has happened. There's not much we can do about that at this point.
Well, Jon, you said the word causes. So I'm going to ask Mispa Satar's question at 1249, which are, what are the causes of perfectionism? Which is probably a broad and difficult question to answer. But if you could answer it, and then maybe what are some ways you can try to ward off becoming that maladaptive perfectionist?
Right. I mean, this is going to be an area of speculation, but for example, the conceptualization of perfectionism by Randy Frost and his scale, the multidimensional perfectionism scale, includes aspects of parental expectations and parental criticism. So, so there's some thinking that the home environment, put an undue emphasis on high standards, and that was then internalized by that individual who then believed that my, reaching these standards or achievement is necessary for me to be okay or for me to have worth. So, that is, one conceptualization of looking at what were the messages that were internalized growing up in terms of how this perfectionism manifests for them later on.
And has that been researched and proven that might be one of the causes, or is it just kind of speculation?
I mean, in order to actually, we would need these longitudinal studies in order to be following people and have a good sense of the home environment. We have, these retrospective studies where people have reported on the home environment and the type of, sometimes it could be these internalized messages from parents or caregivers, or it could be this chaotic environment that then the person tried to compensate by creating a lot of rules and order. Again, we would need very carefully long-term longitudinal studies to have a better sense of this. So to my knowledge, it's not been empirically established. Are you aware of anything, Mike?
No, I mean, I think you would need to do an experiment that would be completely unethical to do, to randomize certain children to overly punitive parental criticism for any small mistake, and then randomize some other children to a more accommodating, compassionate parent. I think it's all going to be kind of retrospective reports.
And ideally, they would be twins, right?
And then be twins, right? Yeah.
And that's one of the problems with answering. I mean, the question about cause is a really important question, causes of anything, right? But like in terms of us being able to figure that out, there's so many variables that have to be held constant. And to really know cause, you got to do the experiment that Mike said, right? If we want to know about, biological cause, you have to randomly assign people to have some sort of biological insult. Or if you want to know about, parenting or other sorts of experiences, we're not going to do those studies. They are unethical. And so all we have are guesses, as Mike and Anthony are saying. Yeah.
Okay. And Anthony, it seems like you're not a big fan of those retrospective type of like looking back studies.
Yeah. Well,
why not?
I think they're like hypothesis generating. Like you can look back and see like what people report, but retrospective studies are biased because we're influenced by how life turned out. So people have recall bias. So there's error in those kinds of studies, but sometimes it's the best we have to try to get a sense of what we can then try to more carefully study.
So are there any other theoretical stabs at the causes just to honor the question?
I mean, there may be a biological piece to some of these personality traits like perfectionism, so looking at genes and stuff, but like, is there a perfectionism gene? No, not that we've identified. It's probably like a multi-genetic kind of thing, but that is something that, we know that when we've looked at, not we personally, but like when the field has looked at personality, there's especially in like these, monozygotic versus dizygotic twins, there seems to be like a role here for genes.
Okay. I don't know where you stand on genetics research, but I know where John stands. Well, I want to ask one more question before I have to wrap things up. But this is Kelly Rubin's question at 12:12. Any guidance on managing perfectionism? If you're someone who's dealing with perfectionism, what can you do to help break it?
Yeah, I'll just break down some of the things that we do in our treatment, and this is something that we do here at Northwell, and I know Mike does as well in his practice. So somebody with perfectionism is going to be like overly identified with these kinds of thoughts and rules. So like working with them to, from like an ACT perspective to like diffuse from that and to be able to like change their relationship with thoughts, being able to observe that without feeling like as reactive to it. Being able to identify cognitive distortions, as we mentioned earlier, doing behavioral experiments to test out breaking of rules, encouraging willingness to be uncomfortable for like the life you want. But the other piece I wanted to emphasize is self-compassion, because the self-criticism is so much a part of this that you really need to work with that individual to like identify when that inner critic is being activated and how they can then move towards like showing care to themselves the way they would show care to other people. So those are all different aspects of treating perfectionism. And just to put out more hope out to the viewers is that we know that perfectionism treatment, the data is good in terms of efficacy, whether it's CBT, whether it's ACT. And so these approaches work well. Now it's about like the dosing and what's the best modality, and versus individual versus group versus like intranet based. But the data is promising.
Yeah, and I would just say like this idea of self-compassion self-forgiveness as being something that one can practice and one can learn. And like I have students working with me right now where we're doing a study. We're actually in the process of just starting the data analysis and writing it up. There's like a modular self-compassion intervention where you actually purposely recall a mistake, and then you go through 3 different steps to sort of try to practice self-compassion, where you like what the first one is universality of concerns, that like people make mistakes, and trying to see that you're not the only one who's ever made a mistake. And then practicing kindness to oneself the same way you would practice kindness to another. So it's almost like writing a letter to yourself where you're trying to extend the kindness and compassion you would extend to someone else that this mistake had happened to. And then the last component, sort of like Anthony was saying, was almost like mindfulness of the experience of like, this is the emotion that it brings up, but not letting, like observing it, but not letting it carry you away, not getting carried away by the emotional experience.
John, would you have anything to add?
No, I completely agree, and it can be really helpful. These interventions can be helpful for folks. It takes a lot of work. The person has to be, as Anthony was pointing out, people have to be, willing to kind of rewrite their, kind of rethink their stance toward these kinds of thoughts and feelings, and then learning that they can manage things. Don't the perfect is the enemy of good.
I heard that expression for the first time 2 weeks ago, and it's my favorite expression ever now.
It's a good expression. Yeah.
Mike, quick, what's the name of the exercise? Kelly Rubin asked.
Yeah, so it's called self-compassion intervention. If you email me, I can send you the article that developed this approach.
All right, well, thanks, guys. That was I hope everything that we said kind of flowed naturally. I kind of got caught up in what everyone said and then asked like the next question that came to my head. I hope it flowed well. But thank you both for joining. I have a couple announcements for everyone watching. First, registration's open for the 20th annual OCD conference. So there's still plenty of time to register. Go to iocdf.org/OCDcon and make sure you do that. Also, OCD walks are taking place all across the country. I know there's one happening in Costa Mesa, California. If anyone watching is in Costa Mesa, California. Yeah, so thank you both again. And this was a lot of fun, really informative.
Yeah, thanks, Kyle. Thanks, John.
Yeah, thanks for organizing it and inviting us to come.
Yeah.
Okay.
Thanks for coming on, guys.
Of course, great to see you guys. Right. Bye.
All right, bye-bye.
Bye.